Good afternoon, everyone. Thank you for being here today. Once again, I'd like to give my gratitude to the local media who are helping carry these important messages to our community so we can minimize the confusion regarding information that changes rapidly, tamp down perhaps on some of the fear that's going on in the community, maybe mitigate some of the worried well folks who think they are sick, and then of course most importantly to provide the public with as much information as we have about how we're doing in this unprecedented situation regarding managing a pandemic. I'm Andrew Rand. I'm the chairman of the Peoria County Board. I was here a couple of days ago. Mayor Artis and I are going to switch days. I don't think it's anything other than a change of local leaders that you're seeing. So this is sort of a new week for us in this process. I want to just tell you that the CDC and the Illinois Department of Public Health and our local Department of Public Health continue to advise us to stop doing and start doing some of the very same things. And we're going to get just real quick. Avoid contact with sick people. And I know that seems obvious. It is difficult for folks to do. But avoiding contact for sick people, and of course if you have to care for them or be around them, then you should be taught as a caregiver how to protect yourself. Hand washing is not an option. You should wash your hands vigorously with soap and water for at least 20 seconds, several times throughout the day, and certainly when you come in contact with other people in your circle. It's just imperative that you understand that your hands are one of the principal transmitters of unwitting transmitters of disease. We want to remember not to touch our face, our eyes, our mouth, or nose with our hands. Don't scratch your face. It's hard to do. I know I get busted by people in my office all day long. And when it comes to coughing and sneezing, I want to remind everybody to please cover your cough and of course wash your hands afterwards. If you don't feel good, don't go to work. If you don't feel good, contact your primary care physician. If you don't have a primary care physician, I'm going to talk to you about 211. After we announced yesterday some expanded capacity, our call volume doubled. Many of those calls were about the ongoing COVID-19 pandemic, and we were able to refer many people who don't have physicians to Heartland Health Services, who is providing access to primary care physicians when you don't have one, and that's regardless of your ability to pay. So 211 continues to grow in the delivery of its services to the community as an information and referral source. Please, if you don't feel good, contact your physician, talk to their nurse triage line. You may have to wait a little bit, and if you don't have a physician, call us at 211 and we'll make a connection with you to the Heartland Health Clinic. Today, Chairman Zimmerman of Tazewell County, Chairman Krug of Woodford County, myself, and Mayor Artis issued our emergency declarations regarding the virus. There are a lot of things that we're able to do as a result of enacting the authority the four of us have. It's important to note that the four of us are working together on this, as the Tri-County region is a metropolitan area that works together and shares a lot of resources, and of course the largest downstate collection of professional health care is right here in Peoria, and it's the best collection of health care. There are also some ongoing concerns, and I met in my team today at AMT to talk about creating access to our behavioral health coaches. We've had employee assistance programs for years in our organization, and as opposed to referring folks out, whom we think may be struggling with an issue in life, we're going to actually start bringing them into our business and provide our team what I would call involuntary counseling, in the sense that we're dealing with a lot of sick people. Our employees are exposed to a lot of things. Everybody that's going to work, that has to work, that's in occupations that can't stay home and self-isolate, is involved in providing some kind of service or product in the community. And whether you're working or not at home, access to behavioral health and coaches to help strengthen us in moments like this, I think is super important. So as an employer, I know that I'm doing that where I work. If you know people who are suffering or you think they're suffering and they need access, and you don't know where to get it, once again, 211 can help you do that, or ask your employer for help. It's time for everyone to step up and recognize that being healthy is a lot more than just not having a fever or a cough. And I'm more than happy to tell you that I enjoy our behavioral health coaches because they're always finding something new to help coach me up on it. I appreciate all the healthcare providers that are part of this process, but let's not forget those who may be suffering or scared. I think I'm done with my part. My job is to introduce the director of the Public Health Department here in Peoria, Monica Henriksen. Thank you all.
Good afternoon, and thank you, Chairman Rand. As usual, we begin this briefing with the totals for the Tri-County area to date. Total number of confirmed is still 4 for the Peoria, Tazewell, and Woodford region. Total number of negative tests is 18, and the total number of pending tests is 15. Again, this is for the Peoria, Woodford, and Tazewell regions. As case numbers grow, so does misinformation often found on social media in regards to how contacts are notified and how tracing investigations happen. This afternoon, we released a media briefing on how investigations, or contact tracing as we term it, go forward. To understand, there are a variety of risks or risk levels when exposed to COVID-19. Part of our investigation is to actively understand what the risks are, if it's a medium or high, as well as those that are low, and address it by providing them contact information and following up with them. Remember, not everyone that is exposed to this is the same risk. Individuals that have close contacts, perhaps sharing a household, are high risk. Others that are within a small confined space for prolonged periods of time can be at a high or medium risk. But having a brief encounter with someone puts you at low risk. But I think what's really important to understand is that while individuals would like to know what their risk is and understand if they themselves have been exposed, in our nation's response to COVID-19, it is time to really change that mentality. We no longer should be thinking of ourselves as whether or not we have been exposed, but more importantly, that we have been exposed and what we are going to do to eliminate or slow down that transmission. This is a huge transition in our mindset as a community. Based on that understanding, low risk or the general public should be following the same criteria. That's social distancing, self-monitoring, even at home. Understanding that if you are sick, you should stay home. Monitor your symptoms. Try to make sure you really are going out for most essential needs. This is, again, a really difficult time, and we appreciate the individuals that are wanting to understand how their own health is impacted. But again, if you have low risk or your general public, you're one and the same, and you should really kind of approach this as understanding that you have been exposed at some point in time. This is not to cause hysteria, but to just heighten your awareness of how this transmission of this virus works and understand what you can do to protect our community at large. Today, when the governor announced increases in cases throughout the state, many of which were located in long-term care facilities, just understanding that our high-risk population is very vulnerable, and we want to make sure that we can address that. So again, taking those additional precautions as the general public is really important. Today also marks the second day of our feeding program as a community for school children. And so with that, I'll turn this to our superintendent, Peoria County, Beth Kreider. Before I do, though, during this closure, the health department recently had to close, and we were unable to have our annual food safety award. Of the 10 food establishments that were awarded food safety awards for 2019, 7 were schools, which doesn't surprise me, because our schools are continuously committed to not only food safety, but providing healthy, safe food to those kids. And I think it's very apparent in these past 2 days. Beth Kreider.
Hello, everyone. And since we can only have 10 people in the room, I'll do the woohoo, way to go schools on their safety compliance. Welcome to our table. That is our theme now that we are supporting and serving our students all throughout Peoria County. We are so honored to be able to serve in this way and in this time of need. As you have heard the word unprecedented, it certainly is. But we have figured out a way. Our superintendents in Peoria County have been unbelievably, they have been working together and making plans and sharing information, and hence over 3,000 children were fed yesterday and today, and that number has grown. So in Peoria Public Schools alone, meals were delivered at several different sites. The schools hosted it, and the Salvation Army helped deliver meals to kids that couldn't make it to those sites. We're hearing more and more about other door-to-door deliveries that are needed, and we are working hard to meet that need as well. Out in the county, I saw an amazing tweet from the Elmwood School District where hundreds of bags were lined up and being stuffed by staff, and were also getting ready to be delivered. Some school districts are using school buses, some of them are using vans, but however they're doing it, they're getting it done, and they're being delivered to children. And so I just want to let the public know that if you need a meal, please check your school district's websites. They will list for you where those pickup sites are for those meals. When you pick up a meal, most likely it will have breakfast and lunch in it so that you can have breakfast for the next day. And Peoria Public Schools in particular, please check their Facebook page and check their website. It has all the sites listed for you. I'll close with the fact that our superintendents are working day and night to make sure kids get what they need, not only with these sack lunches, but with learning, e-learning, and home learning. We meet every day on a Zoom conference call to make sure that we're sharing resources, meeting needs. And with that, I'll turn it back over to Monica.
I'd like to introduce the Chief Medical Officer for OSF Healthcare, Dr. Velasquez, to talk about OSF's response in our community for COVID-19.
Good afternoon. I'm glad to be here. OSF Healthcare has been actively coordinating all efforts with all the county health departments and all the markets that we serve. We have a number of physicians in local areas as well as our hospital administrators working closely with the health departments to support all of our communities. We are monitoring activities across the state. We are sharing information. We have certainly spent a great deal of time training all of our staff to be properly prepared for patients as they present, to help guide them through the proper medical evaluation, as well as understanding some of the anxiety that may be occurring with these events. I'd also like to point out that all of our facilities are remaining open. They are seeing patients in the offices. We are seeing patients for lab testing and diagnostic testings when appropriate. We have counseled patients who may be at risk to possibly reschedule appointments, so we've been accommodating that. And we've also been supporting our communities and providers with digital health solutions. We will continue to roll those out. You will hear more about that a little bit later today. Since we do cover a couple different states, we also are trading information between the different states and how they're approaching this to try and make sure all of our providers are updated. We do refer to the experts. We refer to CDC, we refer to the World Health Organization's findings, and we continue to share that information and push that out to all of our providers and all of our communities. We have daily calls with our providers to find out what's working, what's not working, what do they need help with. We are in constant monitoring of our supplies and our inventory to be able to shift it to the markets if there's a need in one particular market. So we're trying to be ready and prepared to serve all of our communities. Thank you.
As Superintendent Beth Kreider even mentioned, having Zoom conference calls, Dr. Velasquez, even the digital era, and even with us with limited space, digital and being able to do virtual health is becoming more and more key as we use that for a response effort. And with that, I'd like to introduce the Senior Vice President of Digital Health at OSF, Jennifer Junis.
Thank you for your time today. I want you to know that OSF Healthcare is rapidly deploying digital tools to help with the outbreak of the COVID-19. We want you to visit our chatbot, Claire, on the osfhealthcare.org website. Claire can help with resources and information, as well as start that screening process. We also have an OSF nurse hotline. You can call the hotline at OSF 1-833-OSF-NO, as well as we have a texting option. You can text for more information to text OSF to 67634 for information and guidance on COVID-19. We are rapidly deploying these tools as a way to continue to help our community stay in their homes and reach us digitally and provide that information and that care and compassion that we serve at OSF with. Thank you.
So between the contact tracing as well as understanding the need for screening by a healthcare provider, the real test comes to understanding that not everyone is required or should be tested. And with that, we have Dr. Roxa from Unity Point Health to talk about testing specifically within laboratory.
Thanks, Monica. I just wanted to let everyone know today, Unity Point has been working very closely with the Peoria County Health Department to determine who does need testing. There has been criteria changed across some of our other system states, including Wisconsin, and we are taking this very seriously and making sure that people who appropriately need testing are going to be tested. What the national media is telling everyone is that there are lab tests for everyone out there, and that is not what we are seeing. Lab tests are being allocated to large reference labs in areas with high activity. It is turning out to be about a 6-day time to get results for our normal patients who are coming in and wanting to be tested that are outpatients, so someone who's not hospitalized with severe respiratory illness. Severe respiratory illness patients are taking 2 to 3 day turnaround times at this point. We want everyone to be aware. We want people to be tested. We just do not have the capability of doing that. And this is not a Unity Point issue. It's not an OSF issue. It is a national issue that is being faced by many, many of our patients, and we are very gravely concerned. We will be coming out with stricter criteria, working very closely with Monica and other health departments to make sure that all the patients that should get this test will be getting this test so they can be treated appropriately. Thanks, Monica.
Well, with that, we'll open it up to questions from our media. I just ask that, again, because we are trying to keep that social distancing between gatherings, if you have a question for one of our speakers, it might take a while for them to come here.
Monica, the state saw over 100 new cases just in the state, not the county, but that's not just 100 new cases off the bat. These are people who have had the COVID-19 for a while, right?
Yes, majority of those individuals have been tested, and with that, that means they were symptomatic, that they were demonstrating certain things that warranted from their healthcare provider that additional test as well.
Just a clarification question. So there are no new cases in the Tri-County area. Can you tell me again how many were negative and how many are pending?
Of course. So there are now 18 total negative cases to date, and 15 cases currently pending.
The positives that we do have, are they considered community spread, or were these people overseas or with someone who was overseas?
Majority of it had travel-based.
Travel-based?
Yes. Some through domestic, some internationally.
Okay. And have we expanded our testing parameters in the last week?
In fact, we're actually, because of what Dr. Roxa had commented on, testing is really going to be looking at prioritizing even more stringently. Because we do not have that much testing available, we need to make sure we prioritize that testing for those individuals who, with the diagnosis of COVID-19, are at a higher risk for mortality or fatality. And the reason why we need to prioritize that is if an individual that is in their 30s or younger, very good health, is diagnosed with COVID-19, their care is not any different whether or not they were tested. We're going to still require people to stay home, self-medicate with a fever-reducing medicine, stay hydrated, as well as plenty of rest. And we actually have Dr. Vasquez here to talk a little bit more about what a clinician would say to someone if they were tested positive for that.
Well, before you, when you say stringent or stricter, do you mean like age groups, or because before it was pretty strict at 4 qualifications or 3 qualifications? What should we see now in terms of who gets tested and doesn't become the criteria?
So I think that it's really looking at prioritizing and understand what your limited scopes are. There's high-risk individuals that you want to target. So, looking at congregate living settings, individuals with comorbidities or the other health issues that might put them at a higher risk. We really want to make sure, again, those individuals that are at a level where a diagnosis of COVID-19 would put them at a higher risk for complications or even mortality, we want to be able to catch that earlier so that we can manage that. Versus, again, 80% of the population that will get this will get a mild illness that would require them to stay at home and then self-medicate with Tylenol, rest, and fluids. I'm going to speak a little bit more to that.
Be happy to. Good question. When we think of people who have respiratory illnesses, there's a wide range of illness. There's mild, where you may have runny nose, mild cough, fever, that you treat symptomatically. You can take over-the-counter medications. You can take Tylenol for fever. Some of the earlier studies we're seeing from other countries are saying do not use ibuprofen at this point. We don't know the science behind that recommendation yet, but they are saying the preferred treatment for fever is Tylenol. So as the disease progresses, if it starts causing some shortness of breath, more difficulty, more persistent coughing, those are the patients that we would like to have test kits available to test for COVID, because then there may be some treatment options that we want to be more aggressive with. We would want to catch those people before things got worse, if possible, and continue with supportive care for them as if the disease progresses.
So I know you said that you are going to prioritize people who are at high risk, as opposed to those who, she mentioned someone who might be 30, who may have, just symptoms. Are you all saying that someone who is 30, someone who doesn't have pre-existing conditions, cannot die from COVID-19?
No, we're not saying that at all. We're saying, keep in mind, when we talk about high risk, the group that we've talked about the most is the elderly. That's where we've seen the highest mortality rate. But there's also something in many of those elderly patients that we've noticed in people who've had severe disease. They may have comorbid conditions. They may have other diseases, other chronic diseases on different meds for chronic diseases that may impair their immune system. So some patients who are on medications where, because of an impaired immune system, they will be at higher risk too. So that the virus doesn't recognize just because you're under 40 and you have those conditions that it won't affect you. So that's, we do consider those as part of the high risk category, not just by age.
What has been the problem with ibuprofen? Why do you not want people to take it for this?
That we don't know. We're still, that's some of the observations from other countries.
Okay.
We're not sure the science as to why it may have a negative effect. So
Do we know what the negative effect is?
We-
What's the report?
right now, we're trying to figure that out. The typical problems that they may have is effect on the kidneys, may have effect on the GI system. Those are known side effects from those types of medications.
Okay.
I have a question for Dr. Roxa.
Well, Dr. Roxa.
When you were up here, you said that national media outlets say that there's a test for everyone. What media outlets were you referring to?
I don't know them off the top of my head, but I know that we have heard from even some of our national government that anyone who wants a test will get a test. You've heard that too, yes.
And why are basketball players who are perfectly healthy getting tested? Why are these celebrities getting tested?
Right.
Why did Trump get tested? And people who are really sick are not getting tested.
Yes, I know, and Bill de Blasio said the exact same thing in the New York Times as well. And I think that is a major concern. We don't want this to be a social issue. Just because you have the money to be tested and treated does not mean you should be. This is healthcare, and everyone who is sick and needs to be tested and treated really should be.
Does testing remain done by the labs now?
So testing, I cannot speak for Chicago. I know that the two healthcare systems in Peoria are sending labs out currently. I will tell you from a Unity Point perspective, we were sending to a large reference lab, and that lab actually shut down testing except for very specific sites. So we had to send to another reference lab. And the reason was they reached capacity and they couldn't give results for over 2 weeks. And they realized that's not good patient care. It's not that lab's fault. It really is just the way the epidemic is progressing or the pandemic is progressing, and everyone wanted to be tested. And we didn't have strict criteria, and labs were really trying to accommodate their patients, saying, well, they said I could be tested. They said it could be tested. And the reality is we're not going to be able to do that anymore.
These are private labs you're referring to, the state labs? Or?
So, yes, no, it's like LabCorp, Quest, ARUP. I know Mayo does not have a test up and running yet, but they are working very hard to get a test up and running. There are other vendors as well. Cepheid is one, BioFire is another. They are all trying to get assays out there. And when they do, we may have more capability of testing patients. However, lab medicine moves very slow. We wait on the FDA to get those tests approved, and the FDA is trying to relax some of the rules, but we really have to have good quality control. Otherwise, we'll be turning answers out that aren't accurate.
Last week, Monica said that the problem was both supply of the tests and backup at the labs. Is that still the case?
That is still the case. And Monica, are you okay if I speak to that with Illinois? So Springfield, last week we were able to get 24-hour turnaround times because there was not that many people being tested. Now it's 48 to 72 hours. And I know they are working very hard. We have a lab that we're sending to in Kansas City. They are running this test 24 hours a day. So it's not that the labs aren't just taking their time to do it. It's just that they are backed up so much. So
Dr. Cruz said that, Dr. Cruz at OSF today, he said that they test for coronavirus, normal coronaviruses, in-house.
yes.
Is it going to be possible? Why is it that hospitals can't do it in-house on this one?
This is a novel strain, and so when we look at what OSF was talking about, there's something called a respiratory virus panel, and we test 23 different targets. We do this at Unity Point as well, and there's 4 main strains of coronavirus that cause the common cold, respiratory illnesses during the normal flu season. So we are able to detect those. However, what they do, trying to not get too technical here, you have primers and probes, and you look at very specific areas of the genome of organisms. This coronavirus has mutated to the point that those primers and probes cannot detect this with the way they can detect the other 4 strains.
So you need a more specialized test.
You need, yes, and more specific to this strain.
So Dr. Cruz said today that across OSF's 14 hospitals, there's about 300, 400 tests. Can you speak to where Unity Point is on that count?
300, 400 tests pending?
300, 400 tests available, test kits available across all 14 OSF hospitals.
So I can't speak to the number of tests available for COVID-19 specifically. I can speak to other respiratory tests, but you're probably speaking about COVID-19.
Yeah.
Yeah, I cannot speak to that. Now, as far as collection kits, because that's another issue that we are really running into, when patients are being collected, they have to have a swab put in their nose, and those swabs are also running out. So I know that we have plenty of swabs right now, but if we continue to test the way we're testing, we won't even be able to collect for these tests.
With the movement towards private labs, is it still remain free to be tested for COVID-19, or is there will be a cost soon?
So I do know from the labs that we have sent to, there is a cost to us to send. I do not know what the government is going to be doing. We have been told by the government, I'm sure you guys have heard this as well, that some people will be testing will be free. But I honestly don't know the answer to the way that's going to pan out.
Can we talk about how the increasing delays in getting the testing process and turned around? I mean, is that making it hard to assess the scope of the actual COVID-19 problem?
You want to talk?
I can talk about that. I mean, I think testing is a diagnostic tool, and while there is limited testing, the understanding of whether or not the 4 cases is a true representation of what we have in our community. I think that's what the question is going towards. And because we have become more needing to prioritize, and also understanding that a majority of individuals will have a mild illness and can self-treat at home, it is safe to say that the level of this virus in our community is more than just those 4 cases. And that's why it is important to, rather than determine whether or not you are exposed, to start kind of changing our mentality and say, we are exposed, how do I prevent the transmission to others? So that's that social distancing, good hygiene, staying home when you're sick, and then talking to your healthcare provider if your symptoms change. We have 4 confirmed cases to date. We have 18 negative, 15 pending. In all honesty, this is within our community, and we should really be, as a community, proactive and think about that high-risk population that having this virus will be very difficult for them, and start acting more in the best interest of our neighbors and understanding that.
No new cases today, but you do see more cases coming in the near future.
I think it can be safe to say yes.
Have we seen any evidence that it's getting into the nursing homes here?
No, not. And again, I think the biggest thing is that the IDPH guidance on nursing homes has been really working hard to kind of control that in terms of prioritizing testing for nursing home, not only patients but also staff, but setting up active monitoring for staff, doing visitor restrictions. All of those are those non-pharmaceutical interventions that we can utilize when we have no medication or no vaccines available.
I have a question for Beth Kreider.
Beth Kreider, is she still here? We're trying to be very good with numbers.
We were pretty crowded at St. Francis today.
Hi.
What should parents do to ease the minds of their kids when it comes to the coronavirus? It's something that everyone is talking about, everyone is reading about, everyone is watching. What can parents do at this time?
There certainly is a lot of anxiety, and it's going to present itself in different ways depending on the age of the child. And very young children just want to know that they're safe and that they're cared for and that everything's going to be fine at home. But as children are older, and especially your teens, one thing that I've seen out on social media is that struggle of knowing what to tell the teens. They need to be on the same team that we're all on. We all need to stay home. And that is a struggle that I have seen out there, and how to communicate that message, because a lot of them are seeing this as a time to go over to their friend's house. In my own home, I've told my children that they can't go see Grandma and Grandpa right now. We're all going to be staying at home. There are many resources out there. We have a team that is dedicated to putting that all in one place. We will figure out how to share those things out. But it's a lot about just reassuring them that if they stay home and they stay in their place, that we're all going to be okay, and sharing that message of we are better together. So we are all working to support that, and we will figure out how to get those resources out there. We have an entire division of our Emergency Operations Center that is working on getting those resources into the community.
Just
With
a
all these
clarification.
classes being closed down right now, what are some recommendations for what kids can do at home to keep on learning and basically keep their education going?
Absolutely. If you are on social media, there's a lot of that going around, but many companies are now currently offering their resources for free online. You can find that with a simple Google search. There are museums that are offering free virtual tours. It is amazing. I've seen those out there. Again, we have compiled all those resources into a common place, but it's on a Google Doc, and we will figure out how we can get that shared and where we can post that so that the community can have free access to it. So I will get that information out in a press release very soon.
So isn't it true that ISB has says that due to the statewide, I guess, lack of preparation for e-learning, not Peoria County specifically, that e-learning grades are not going to, they're not going to count essentially?
That is, the Illinois State Board of Education had a 2-hour call-in conference yesterday, and one of the main questions was grading and how is this going to work. We were told that no negative grades can impact the students. So that is interesting to interpret, and so local school districts will have a lot of flexibility of what they do with that. The key for us is we want students engaged. A student that is learning, has at-home activities, that will help reduce the anxiety and keep them focused. And so we want learning to continue. All of my districts here in Peoria County, at least, they have a plan. And so that plan looks different depending on where you're at, but there are packets that are going home of paper packets. There are e-learning activities online with devices. It looks different everywhere you go.
So I know a lot of superintendents are preparing for the possibility this might go past March 30th? I don't have a crystal ball, and nobody does, but I know a lot are preparing for it. So, I mean, if this does go past that, I mean, how's that going to impact, as we move towards the end of the school year, into April perhaps, like, if we can't, tabulate these grades? I mean, is there a game plan in the works for how that works?
I keep coming back to the word unprecedented, but I will refer back to the Illinois State Board of Education webinar yesterday. The webinar was supposed to be about e-learning, and that it shifted to what to do during a school closure, and they took over an hour of questions and answers. And everything revolves around this idea of waivers. Everything we do in schools is in the school code. What the legislators have told us that we are required by law to do. So when anything shifts, like an act of God day for these 2 weeks, we have to have waivers for the requirements. So the State Board of Education is compiling what all those waivers would look like. Graduation, missing fourth quarter, e-learning. So they're compiling all of those, and we're working through them. But about 3 to 4 of the slides on that webinar stated, please start preparing for long-term closure.
Can you just say again the amount of meals? You said a specific amount of meals that were served since yesterday?
What I know is Peoria Public Schools posted an exact number on their Facebook page, and it was close to 3,000. And then in the community out in Peoria County, there was at least another 1,000, because I saw hundreds of meals going out from the different school districts as well.
Thank you, everyone, for the daily briefing. We will be back here again tomorrow at 4 p.m. Thank you.
Thank you.